Hi, my name's Brooke and I'm with Golden Years Insurance. And if you're about to turn 65 and retiring, you may need to know some Medicare Basics. So I'm here to help guide you through that. So let's start by talking about Original Medicare. So Original Medicare is consisting of two parts, which is Part A and Part B. Part A is going to cover your inpatient hospital stays, skilled nursing, and some home health care. Part B is going to be all of your outpatient services like doctor visits, labs, preventative care, durable medical equipment, and some prescription costs depending on what it is. Let's talk about the cost involved with Original Medicare. Part A is usually premium free as long as you or your spouse have 40 working credits or 10 years of full-time work. Part B is going to have a premium involved with it, and it can depend on your income, and it does fluctuate year to year. Here's the thing though, Original Medicare is not going to cover all of your costs. They typically will cover 80%, and then you are responsible for the remaining 20%, and there's no cap on that. Original Medicare is also not going to include things like dental, vision, hearing, or prescription drug coverage. So those are things that you're going to need to get separately. Once you're enrolled in Part A and Part B, then you have two options to add to Original Medicare. So your first option is going to be a Medicare supplement plan, also referred to as a Medigap plan sometimes. So those can come in different forms, and some of them will have copays and coinsurance, but typically they are going to have a higher premium every month, but there is not a set network. So you can go anywhere Medicare is accepted, and you don't have to stay inside a particular network of doctors, which is really nice for some people, and some people don't want to have to worry about staying in a network. With a Medicare supplement plan, you do want to add a prescription drug plan with that. So if you don't sign up for a prescription drug plan when you're first eligible, then you could have a penalty involved when you do actually sign up. So that's something that you need to be aware of. Your second option is going to be to add a Medicare Advantage plan. These are kind of all-in-one plans offered by private insurance companies. So they'll take dental, vision, and hearing, and some of them have prescription drug coverage built in as well, and they kind of bundle that all together. And these are going to be typically lower premium per month, and then you will have copays as you're using your plan. So as you're going to the doctor, as you're getting, procedures done, you'll have a small copay instead of paying a high premium up front. Now these plans do have networks, so you do need to stay in a particular doctor network. So you'll want to double check and make sure that all of your doctors take the carrier that you decide to go with. So I want to take a minute and talk about penalties, because penalties are a real thing. They do exist, and we don't want you to have any penalties. So if you don't sign up for Part A and Part B when you are right when you turn 65, you have a special enrollment period 3 months before you turn 65, the month you turn 65, and then 3 months after. So if you don't sign up during that time, you could face a penalty. Now, if you are going to work past age 65, you can postpone your Part B. So you can push your Part B out a little bit as long as your employer offers credible insurance. So it has to be insurance that meets a certain criteria that has been set by CMS. So if you have questions about whether your employer's health coverage reaches those certain criteria, you'll need to reach out to your HR department, and you'll probably want to consult a licensed insurance agent to make sure that you're just crossing all your T's and dotting all your I's. These penalties will add up over time, and they are in place for the rest of your life. So we want to make sure that you are not getting penalized. So please make sure that you reach out if you have questions. So just a reminder, Original Medicare consists of Part A and Part B. And then you have the option to add either a Medigap plan with a prescription drug plan, or you can do an all-in-one Medicare Advantage plan. So don't delay your enrollment in Medicare unless you know that you have credible coverage through an employer or some other coverage. Certain circumstances may apply. So definitely reach out to a licensed insurance agent to help guide you through that process. Please comment, like, and subscribe to this video if you felt this helpful, and check out my other videos. And then if you need help and would like to set up an appointment, I am licensed in Utah, Nevada, Idaho, Wyoming, and Oregon. I may add additional states, so please let me know how I can help, and please don't hesitate to reach out if you have questions. Medicare does not have to be overwhelming, so make sure that you have someone who cares that's going to walk you through the process and be there for you the entire time. With my clients, I am there year-round to help them if they have questions with claims or how to use their benefits. I am here to be a resource for you and to help you through the Medicare maze.